So I'm Ron Pies, and I am editor-in-chief emeritus of Psychiatric Times 2007 to 2010. I'm also a professor emeritus of psychiatry at SUNY Upstate Medical University, and I have a similar position with Tufts. I think both my co-author, Dr. McIntyre, and I felt that in recent months there has been a lot of misinformation about antidepressants. Some of it, unfortunately, promulgated by high officials within Health and Human Services. I don't think I have to name any names, but comments about the risks of antidepressants that were way out of proportion to the actual risks and really quite alarming. There has also been a lot of legitimate concern among certain lay advocacy groups and also among patients themselves, legitimate concerns about the safety and efficacy of antidepressants. And we can't ignore those voices, even though we may not always agree with their conclusions. And certainly there has been a good deal of attention given to the issue of antidepressant withdrawal syndromes. That seems to be the focus of a lot of input, some of it quite emotional on social media. So those were some of the reasons that Roger McIntyre and I wanted to do this article. Well, I think we want to have our colleagues put the risks of antidepressants in perspective with the benefits. Just to start out, how effective are these agents? Well, I don't think anyone who is in psychopharmacology or a mood disorder specialist would argue that these are tremendously, robustly, miraculously effective agents. They're not. They're really kind of so-so agents. And if you look at the figures, they are more effective than placebo. There's no question about that. Though there is a large placebo component to their activity, and we recognize that. But we want to put it in perspective. And the studies that we cite in the article, I think, will make that clear that at least for acute treatment of major depression and relapse prevention, these are effective agents. It gets a little dicier when you start looking at the long-term studies, and there I think we don't have the greatest gold standard studies to justify prescribing these agents for 5, 6, 7, 8 years, as is sometimes the case, often the case these days. But certainly in the acute treatment and in relapse prevention, I think there's little question that these are effective. Then I think we want our colleagues to realize that there are risks, but they're manageable risks. And just to jump ahead, I mean, the issue of antidepressant withdrawal is a hot button issue now. I think we've gone through a number of stages with that issue. I think for many years, psychiatrists were not as attuned to this problem as we should have been, maybe not as on top of it as we should have been. And it's really been more in the last 5, 6, 7 years that we've come to realize that we do have to be careful when we're discontinuing these agents, these antidepressants, particularly the serotonergic agents. And we want psychiatrists to be cautious about that and do it very slowly and carefully. But I also think that the issue of the severity and frequency of these withdrawal reactions has been overstated by some writers, some clinicians, and some of these advocacy groups. So the idea really is just to keep this all in perspective, balancing the risks and benefits.